Hi, my name is Doug Sesserman, and I'm privileged to serve as the CEO of Americans for Ben-Gurion University. Welcome to #Webinar Wednesday. This is our 60th webinar. We are streaming live on Facebook, and today we have a really terrific 30-minute program for you. We're presenting Professor Dorit Nitzan from Ben-Gurion University of the Negev, and she's going to speak about healing a nation under long-term stress, which we obviously understand and know is the case. That video gets me every time that I see it. And unfortunately, the numbers we showed at the beginning of the video aren't accurate. It said 115 dead. Unfortunately, I have some bad news to share. The number of dead impacted at Ben-Gurion University now from October 7th and beyond is up to 117. Just in the last few days, we lost BGU alum Alex Danzig, who was taken hostage from the kibbutz near Oz. The good news, if there is such a thing, is that he is survived by 12 grandchildren, and may his memory be for a blessing. We also lost BGU faculty member Itamar Levin Friedman, who was part of our business school faculty and taught at the A-Lot campus, one of BGU's three campuses in Beersheba, Sde Boker, and A-Lot. May Itamar's memory also be for a blessing. For those of you who don't realize, our main campus in Beersheba is located only 22 miles or so from Gaza. We had a lot of students at the Nova Music Festival and have been greatly, directly and disproportionately impacted. The 117 represents close to 9% of all the deaths in Israel at this time from the conflict and those fighting since. We had 75 murdered the day of, and a number who haven't come home from service. Just in terms of statistics, we've had over 7,000 members of our community serve in the IDF reserve duty, 6,000 students, close to a third of the population. 1,500 of them are still serving. So this war goes on, and that brings us to this program. We had great registration, 487 of you registered for this program. Thank you very much. And I just want to say before we start, just quick acknowledgments to the incredible team here in New York and around the country, Lenore Levine, Cheryl Corlitz, Kashia Isabel, and Dana Ben-Benyamin, who works as our liaison in Israel, to put these programs together. And we greatly appreciate Dorit joining us at the evening time, local for her there. As we get started, if you have questions for Dorit, just click on the Q&A function and we'll do our best to get those questions to Dorit as the program moves on. We're joined by Dorit Nitzan. She joined Ben-Gurion University of the Negev in 2002 and directs the master's program in emergency medicine preparedness that is part of our School of Public Health. She also chairs BGU's Food Systems, One Health, and Resilience Initiative. She returned to Israel in 2022 after leading the incident management team of the World Health Organization humanitarian response in Ukraine. Earlier in her career, which has been an amazing career, Dorit led the Nutrition and Food Services Department of Israel's Ministry of Health, and to this day, she continues as an advisor to the Director General on the topic of access to health and services for conflict-affected populations. Her 17-year esteemed career at the World Health Organization included roles such as the Regional Emergency Director, as also the head of the desks in the countries of Ukraine and Serbia. Professor Nitzan is a pediatrician and dietitian. She first studied nutrition at the Hebrew University, then went to Tel Aviv University to study medicine. Before doing her medical residency in New Jersey, she has a number of family members in the States, including her daughter. And she did her postdoc work here in New York as part of Columbia University. Dorit has received numerous awards from the World Health Organization, the United Nations, the Ministry of Foreign Affairs, and many of the hospitals she served. We are very proud to have Dorit Nitzan as part of the faculty at Ben-Gurion University of the Negev. Welcome, Dorit.
Thank you.
I'm sorry for such a long bio, but you have an incredibly impressive career, and it's important for us to share with the audience. Why don't we just start with the big question, right? Can you try to describe the mental health state of Israel over a year after October 7th?
Thank you. First of all, thank you very much, Doug. And I'm so honored to be with you here today with all the distinguished audience, which I cannot see, but I can just feel. And, you know, for us these days, as we are all in this trauma, having friends like you outside that support us and are escorting us through this tough period is so special. We don't take it for granted. So thank you, and thank you all, and thank you, our A-team, as you mentioned earlier. Yeah, so the events since the 7th of October have impacted us all here, and I think many people also worldwide. And here we are looking at it as some kind of concentric circles of trauma. And some of us are in the real epicenter of this trauma. And these are the people that are very directly impacted by that. So these are the people that belong to the acute trauma circle. These are the people who were affected because they are injured, abducted, and their family members, those that lost their loved ones through this period. So many people are there. The second one is those that it's impacted directly, their lives. So not only those that are, that we also mentioned, but we are including here about 200,000 of the displaced. You know, initially there were many displaced from the area around Gaza, but now the northern part of the country is displaced. Many areas are vacant. Many villages, kibbutzim, cities are really empty, as the photos that you showed of Ben-Gurion University just after the 7th of October. So this group of people have lost a lot. They don't know when they will be back, what they will find when they are back. Some of them have already returned, like in Sderot, a city that is still suffering. They returned to a place that now and then they have the sirens going off and they need to go to shelter. The kids are suffering, and the many of them, these people in this second circle, are still in pain, and they don't have the quality of life that they used to have before that. Then we have the circles of the communities, the absorbing communities. And then we have the circles, and of course, not only that, I forgot to mention the people in the military service. How many people in this country are in military service? The soldiers, those that are on reserve and were called or volunteered to come, many volunteers, as well as those that are left at home with kids, with work that no one else can take. So we are talking about husbands and wives of the military, women and men. We have now women in very active positions in the military combat as well. And we have kids that mom, and sometimes mom and dad or dad, are in the military. We have parents that are waiting for the kids, brothers and sisters. The whole mesh kind of so mixed. And when I looked at these circles, when I was preparing for one of our research proposals, I was thinking, none of us is in one circle. Most of us are in all circles, or in 2 or 3 circles. And that brings us to the issue of the mental health in Israel. We know that our nation is our grandfathers or great-grandfathers and parents came from the Holocaust. The country was built on post-trauma. Now, with the long trauma that many of us experienced through the years, we have this acute on chronic trauma. And that actually puts us all in kind of specific picture that no one in the world knows how to help us. So we have to do it with the people outside of Israel, the experts that are coming. And I must tell you, we have 7,000 volunteers that have registered in the Ministry of Health, mostly from the US, volunteering to come and help us here. But we at Ben-Gurion University are specifically dedicating our time, energy, and efforts to learn more how to address it. There are many, yes.
Let's talk a little bit about Ben-Gurion and as it relates to how directly or disproportionately it was impacted because of its location and our responsibility for the Negev region.
Exactly.
Does it, as a scientist, and I know it's hard right now to separate being a scientist with just the emotions and being a person, an Israeli citizen, but does it feel or is it actually different in the Negev or at Ben-Gurion than the rest of the country?
I think I'll start from, the bigger picture. I think being in the academia now in Israel, I must say it's a challenge because the linkages outside with some of the universities and some of our colleagues elsewhere it's being challenged by their relationship with us. In Ben-Gurion,
you're talking about the rise of anti-Semitism and the protests at universities in the US and around the world, and those being your research colleagues, et cetera.
Exactly. And yet we have very good colleagues also in the US, very good colleagues that have been supporting us and working with us. And with them, we find ourselves in Ben-Gurion. And I think that's something special because we have very good relationship with our colleagues. We are delving into this new venture together with them. In Ben-Gurion, we feel it everywhere we go. You mentioned it earlier, students. So many of our students are in the reserve or are doing some life-saving work. They are also helping Magen David Adom. They are helping the hospitals. They are doing a lot of volunteer work for the communities and for their communities and other communities. Then we have the staff. Many of our staff are missing. So we have to fill in and to do what we can to continue learning and teaching in these circumstances, as well as really preparing grant proposal and living kind of normal life when nothing is normal.
Right. There's nothing normal about the new normal.
Nothing.
Could you actually talk about that for a second? In other words, we tend to use the term PTSD, right, which is post-traumatic stress disorder, but there's nothing post about this situation in Israel. The P is actually like perpetual traumatic stress disorder. As a scientist, can you help us understand the difference between maybe what Israel is experiencing from what people typically think about as PTSD?
Yes, so PTSD, there is a window that you can approach the person, the affected person, and if you do the right thing, you know that you can decrease it or you can heal them. In our circumstances, it's very different, very similar to the situation in Ukraine where I worked. And Ukraine, the First Lady of Ukraine took on her the challenge, the mental health challenge of Ukraine. And here in Israel, we find very similar approach. We are invited with a prepared center of Ben-Gurion University that is led by Professor Limor Aronson Daniel. We are invited to the president, the Israeli president, to present a study that is, we were asked to carry out, we were asked by UNICEF to carry out in regards to children here in Israel and their ability to cope with such long and continuous acute on chronic kind of stress. And we see that we have to learn, we have to come with new technologies, with new standards.
Are you able to share any of the data from that research?
So this research that we will present first time to the president, so we have not yet published, so I cannot
I was
read.
hoping our audience was going to get the information
Well,
before the president of the country.
Yes, I can share that the symptoms are clear. Children are suffering, children and their parents are suffering, and we have to find the right way to balance it with the whole environment. So as opposed to the post-traumatic stress disorder where we guide the family, we take care one-to-one, here it's more group work that is needed as well as individual work to see and tailor it for the child's needs. But children, they're playing less, going outside less. They are not really smiling. They are afraid. They see the photos of the kidnapped and they don't know what will happen if I will be kidnapped tomorrow. Will anyone fight for me?
Yeah.
You know, very sad.
Yeah, there's not clear defined stages of the recovery process or knowledge of the long-term effects. Here we are more than 13 months later.
Absolutely. And you know, the Duet Center in Ben-Gurion University that is led by another wonderful woman, Professor Naama Tzva-Poria. They have always been searching and researching it even before October 7. And they showed that the parental care is key. But parents that are suffering,
let's talk about that a little bit. I know Naama, she's an amazing woman and scientist and faculty member. So the Duet Center focuses on what they call reflective parenting. And BGU really is maybe the leader in Israel and one of the leaders in the world in understanding how to help people parent under stressful situations, which Israel's always been under, but now it's at a whole new level. Could you maybe talk about how the Duet Center functions? And then I also wanted you to talk about some of the other clinical aspects that stem out of the psychology department.
Yes, the Duet Center, as you mentioned, before even the 7th of October, looked into it and became a global center in that respect. So what they show is that yes, we are looking at the kids, but we have to develop the parental ability to cope and to know how to deal with it. You know, you can see here, even in the train or in the bus, you can see a child that is just screaming because that's what children sometimes do, but the parents cannot deal with it. And, you know, little things, daily life experiences with kids become such an intense and challenging challenge for these parents, how to deal. So they have to learn, and what they do in Duet, they develop the way to treat and care for the parents in order to improve their kids' outcome and also theirs. That is very special. And, you know, as a pediatrician, it makes we always knew that the parents need to be supported. But here we see it every step on the way, and Duet is quite unique and helpful.
We're getting a question from one of our participants, Dorit Lotan, who's asking, could you elaborate maybe on specific strategies that help the parents parent their kids?
I think that, well, I'm not an expert on the duet centers strategies, but there are specific strategies that they are skilled with, and I suggest to refer the one that asked this question to Naama, to Professor Naama.
Maybe we'll need to bring her on for her own.
Yes, I think that I'm more into the physical, mental of the kids, but how to deal with the parents and what to do with them, it's so needed, and I don't want to make any mistakes.
Are there other aspects of BGU's psychology department or clinical efforts that you wanted to highlight, helping soldier students when they come back from reserve duty,
yes,
etc.?
Yes, exactly. Our soldiers, our students, that many of them have been soldiers, and many of them have been in combat in Gaza, in Lebanon. When they come back, first of all, what they see that the world continued. While they were fighting, we continued to teach, continued to have exams, and to, we have groups now, first year students, huge challenge. They come and they see that they missed something. They missed a whole group. So the psychology department and the other departments of each support groups for them, and also individual care in order to prevent them from post-traumatic stress disorder, but also from feeling that they do not belong here. We work very hard, and I can tell you that all my colleagues, we devote extra time because they deserve. They gave us their lives. We want to help them there. Also, the soldiers that are injured in hospitals need special care, and the university as a whole provides them with support, but also the army and the defense forces do that. So we don't have to do parallel work. What our role is to get them into the university, and when they get back, to get them with warm hug and respect, and to absorb them into the community. Everybody is helping them. I can tell you that my experience in classes is that in every class, every group of students dedicate or nominated one student that writes everything, records everything, and keeps it for those that cannot come. Sometimes they cannot come not because they are in the army, like a mother cannot come because she is left with 5 kids or 2 kids or a newborn. So we need to help them all. It's not only the army. It's so complicated.
We're getting another question from an anonymous attendee about how they could help in terms of volunteer efforts. You mentioned a website from the Ministry of Health, or could you just, what background do people have to have? Can anybody just show up?
Yes, it depends, not to show up. So exactly. Those from the medicine, nursing, and other psychological backgrounds, social work support, mental health, can write and apply in the Ministry of Health website. Okay. We already have so many of them. Those that are that have other capacities, like would like to help agricultural workers or others, there are other venues to do it, but feel free to contact me as well, and I'll link them to wherever they want.
Okay, we'll send out to our attendees a link to the Ministry of Health.
Yes. Yes, it's very important for us, all the volunteers, when you come here, for us, it's heartwarming. May I actually highlight another project that our university, we call it Kalab in Hebrew. Kalab in Hebrew, if you translate, it's a kind of jargon. We use it to close to home, karov labayit, when you serve in the army. but we play with it, and Kalab is Kehila Lema'an Briut, which is community for health. And here we started working bottom up with communities that are left at the border, mainly now in the north, that did not leave because of their own reasons. And we try to make them, to help them become more resilient and more ready to the events that are coming. We have beautiful communities now, and with volunteers from Natan, which is an NGO, where you, by the way, can register into. The volunteers come and work with the communities, train them, and help the social workers, the psychologists, the doctors, the nurses. They all get trained and help each other, because in many places of the world, as in Israel, we noticed and we saw that during the 7th of October and after that, it takes time for the authorities from top down to get to the bottom of the issues. So while they get ready and come from the bottom up, we prepare the communities. And this is becoming very specific. And our students are doing their, what we call Agent O, which is humanitarian needs overview assessment in such communities. They assess. In the second semester, they come with the Agent P, which is the humanitarian needs programs, and they work with them to really establish a great program in each of the regions and each of the villages that is tailored to the regional or the village priorities. This is very special, and we are learning a lot from it on what people need in this time and how people are traumatized.
We're getting a question about BGU specific, like pedagogical response. That have there been additional courses or changes in how we teach psychology, and for what audiences to try to help in this current situation?
Absolutely. I think that in most of the classes that have to do with mental health, physical health, and health services, health structure, and also management, we had to change. We changed the syllabus, we tailored it to what is needed. We include now more, we emphasize more the tools that we know that are established. We learn with the students together how to approach such research, communities and people. And as our students are part of these communities, part of these circles, they themselves show us what to do. So absolutely, we had to change our syllabus.
Thank you very much. Our half an hour flew right by. Did you want to make a closing comment?
I just want to thank you so much. Thank you also for the questions. And I want to offer, whoever is interested in coming, helping us, whatever way or mean you find suitable for you, it would be great, because with you, we feel that we are not alone.
Thank you. David Ben-Gurion, the founder and first prime minister of Israel, said that it was in the Negev that Israel would be tested. And what a prophetic statement that is today. Yeah. He also said that the future would emerge from the Negev, and that's really the role of Ben-Gurion University. And for those of you who haven't had the opportunity to go to the country since October 7th, it's really an important time to visit. I've been fortunate to go twice. And I think when you are in Israel with the Israelis, you'll feel a sense of togetherness, family, and hope, really, for the future, despite an incredibly difficult situation that we're in. In terms of some future programming for us here at Americans for Ben-Gurion University, on December the 8th, we invite you to participate in our third Ben-Gurion Day in the USA program. This is a holiday that is celebrated annually in Israel to commemorate David Ben-Gurion's life and impact on his yurtzeit. And we've been working to spread the word of his teachings throughout the USA. We have over 140 different congregations and organizations participating. There will be a live webinar. You can just take out your phone right now and click on that QR code to register. So for those of you who already have, thank you. And for those of you who have not participated yet in this program, please do so. It will be meaningful. Also, we had questions during the webinar of different ways people could help, volunteer, etc. If you'd like to support our work, you can also click on this QR code. This would take you to a donation page, and you can support the Ben-Gurion Annual Fund of our organization to help the university, its students and faculty where it's needed most. So if you are feeling generous today, please click on that QR code. I mentioned David Ben-Gurion, and we're very proud to have him as the namesake of our university. I lovingly refer to him sometimes as the #2 Jew all time. He had a lot of great sayings, and one of them was that the fate of Israel depends on two things, on her strength and on her righteousness. And we obviously see the importance of the defense forces in protecting the country, and we are so proud of their work and proud of our soldier students who are serving in combat and in other ways. But in terms of her righteousness, Israel at the end of the day is still and always will be Or LaGoyim, a light unto the nations. And at BGU, we think of it as a migdalor, a beacon of light that comes out of the Negev desert and spreads education and research and knowledge throughout the country and the world. And I'm not sure we have a faculty member that represents righteousness as well as Dorit Nitzan. She's an incredible person, dedicated her life at the World Health Organization to really what we call as Jews tikkun olam, to make the world a better place. So we thank Dorit for being our featured guest today, and we thank all of you for joining us. Take care and be safe. Thank you.